Okay, we have a very easy USMLE Step 2 psychiatry question. A 23-year-old woman comes to the campus health clinic because of a 5-month history of sudden episodes of intense discomfort. The first occurred while she was on a crowded bus heading to class. Without warning, she developed pounding palpitations, dizziness, shortness of breath, and a feeling that she was about to die. The episode lasted about 15 minutes and resolved on its own. Since then, she has had similar episodes, initially every few weeks, but now 2 or 3 times per week. She has begun avoiding shopping malls, public transportation, and even outdoor events because she fears having another episode in public where she cannot easily leave. She has no significant past medical history, takes no medications, and denies alcohol or illicit drug use. Her vital signs and physical examinations are normal. Mental status examination shows an anxious mood but no cognitive deficits. Which of the following is the most likely diagnosis? Okay, so let's go through the answer choices and come up with the correct answer through the process of elimination. Somatic symptom disorder. So, somatic symptom disorder is when you have anxiety over your somatic symptoms, right? So here we cannot find anything about somatic symptoms, and we can put A as aside from for now. B, illness anxiety disorder. So illness anxiety disorder is when you have anxiety over developing some sort of illness, and we cannot see any information about illnesses here, so I'm gonna go ahead and set B aside as well. Generalized anxiety disorder. So generalized anxiety disorder is when you have anxiety over multitudes of factors, and this anxiety is pretty continuous. So like you are anxious every day about many things. And as you can see, this is not the case with our patient because she has anxiety, very severe anxieties, but they happen in certain situations. They do not happen every day. They happen in very certain situations, and they don't happen as frequently as they would if it was like generalized anxiety disorder. So I'm gonna go ahead and say that C is not the correct answer either, and D, agoraphobia. So agoraphobia is when we have fear of being in crowded environments, and not really crowded environments, anywhere where you feel like you cannot escape, you cannot leave easily. So here I said this is a very easy question because the question really tells us that she fears having another episode in public where she cannot easily leave. That's a sign of agoraphobia. So D, I would say, is the correct answer. But let's go ahead and see what E is about. So E, social anxiety disorder. Social anxiety disorder is when you have anxiety in social situations, mainly when you are performing something in a social situation. And I wouldn't say E is the correct answer because some students might like get confused because she says that she doesn't want to go outdoors anymore and she fears being in public, but that's not social anxiety disorder because she doesn't fear social environments. She fears not being able to escape a certain environment. So for that reason, I'm going to say E is not the correct answer either, and D is in fact the correct answer. Thank you very much for watching this video, and like and subscribe to my channel so you can see more of these.